So before I walk into the room, I would knock on the door just to make my presence known. I would walk into the room and immediately wash my hands. I would introduce myself to the patient. Hi, my name is Abby. I'm gonna do your student nurse today. I'm just gonna do a quick exam on you. It should be a head to chest exam and take no longer than 15 minutes. Can you please verify your name and date of birth for me? And they would say Abigail Wolf, 120592. And then I would check that against their wristband. I would ask them if they're having any pain, do they have any allergies that they know of, and they would say no, no. Ask them if they have any questions, and they would say no. So then I would begin the exam. I would just do a general appearance of them. Their skin, is appropriate to their race. As I check the temperature, both sides, I would use the back of my hand, note that it is dry, warm, no heat or anything. For their level of consciousness, they seem to be alert and oriented. They're able to answer my questions as I ask them. When I saw them walk into the room, I noticed that they didn't need any assistance with a cane or a walker or anything like that, had normal range of motion. Their level of consciousness, alert, oriented, their behavior, they don't have a flat aspect, they seem to be in a good mood. Whenever I ask them, hi, what's your name, what's going on in the world today, can you tell me the time, where are you at the moment, and they're able to answer all the questions appropriately, so they seem to be in the right mind. For their vitals, once I took the vitals, it was all normal. We have a temperature of 98.6, heart rate of 65 beats per minute. Respirations were 16 per minute, and then their O2 was 99%. When I assess their skin, face, skin, I noticed that it's warm, dry, no lesions anywhere or any abnormal looking nevi, anything like that. No wounds, incisions. Once I checked the nails, I noticed the beds aren't blue or anything like that. They're a normal pink color. When I check the cap refill, they return to normal color within 1 to 2 seconds. There's no clubbing. The angle is normal. No hemorrhages underneath the nails, anything like that. When I'm also checking the skin, I check the turgor and it's normal. When I check the head, I go through the hair and notice there's no lesions, infestations, anything like that. I check all throughout. Whenever I'm looking at the face, I notice it's symmetrical. There's no drooping on one side or the other. There's no lesions, any masses, throughout the face, anything like that, especially around like the sinus area. Whenever I assess the eyes, I use my pen light. I check the pupils. The pupils are equal, they're round, they accommodate appropriately, they react to light as I do the pen light in each eye. And I do the accommodation, so I have them look at my pen light, they accommodate fine, and then I would ask them, can you tell me what time it is? Or can you tell me what's on that picture? And if they can tell me appropriately, then they have good accommodation to the bar pictures or the time. There's no discharge or redness in the eye, no drainage. The sclera is a white color, and then the conjunctiva is a pink normal color, no signs of infection or anything. We look through the brows and the eyelashes. I notice there's no hair loss within both of those or any infestations of any sort. With the ear, I notice there's no drainage. I check both ears and I use my pen light for both. No drainage, no redness. And then when I'm talking to the patient, they're able to, answer my questions as soon as I ask them. So there's no sign of hearing loss, just due to conversation. For the nose, I notice there's no deformities, any inflammation, and I would also use my pen light to just look inside the nostrils. There's no asymmetry or deformities with that. And there's bilateral patency, no drainage of the nose. For my mouth and throat, I would also, again, have them open up their mouth, stick out their tongue, just look inside. Notice that the lips are a pink color, the moisture of them, they're not dry, they're just a normal texture. For the gums and the tongue, I have them stick out their tongue and show their teeth kind of lift up and down. And I notice that their gums, there's no redness, inflammation. They're a normal pink color. The moisture, they're not dry, they're normal. Along with the tongue, there's no lesions. I have them stick them out and check both sides, up and down. Just look inside and there's no abnormalities, lesions, abnormal color to that. With respirations, so that's whenever I would use my stethoscope. Just looking at them, I notice they're breathing normally, just sitting down, no chest retractions, no difficulty breathing, just a normal breathing. So whenever I listen to their lungs, I would use the bell or the diaphragm. So I would listen right upper lobe, left upper lobe, right middle lobe, right lower lobe, and left lower lobe. So I would do the same pattern on the back side to listen to the lobe. So the right upper lobe, the right middle lobe, and the right lower lobe, and the left upper lobe, and the left lower lobe. As I'm listening, I'm not listening, I don't hear any like crackles, abnormal breath sounds. It sounds good, clear. Doesn't sound like there's any mucus or any masses in the lungs. So a good lung exam. So whenever I do the cardiac part, I would palpate the carotid arteries. And the other side. Seems to be a good rate rhythm. And then as I'm auscultating for the cardiac part, I would also use my stethoscope. So I start with the aortic side, pulmonic, Erb's point, tricuspid, and mitral. After using the diaphragm part, I would flip it over and use the bell part. So I'll do that again. Aortic, pulmonic, Erb's point, tricuspid, and the mitral. When I'm just checking the appearance, I would check for jugular vein distension as they're just sitting down, so I don't see any distension. I would move them back to a 45-degree angle and also check again, and there's no distension of the jugular vein. While they're in the 45-degree angle, I would also check their feet just for pedal edema. There's no pitting edema, anything like that when I press on their foot, or just by looking at it, I don't see any edema. For the rest of the cardiac, I would check the radial pulse, so thumb side. Just check that for normal rate and rhythm. And there's no abnormalities felt that I can feel. Normal rate and rhythm. Once I'm done with the full head to chest exam, I would ask the patient again, are you having any pain at the moment? Do you have any questions about the exam? They would say no. I would just check their room, their bed, make sure it's all the way to the lowest point so they don't, when they're getting off, they don't have to, jump or leap. Make sure the bed rails are up, just in case if they're unstable, they won't fall off the bed. Make sure they're in normal range of their call light, and make sure the bed's locked so it's not rolling around. And then after I'm done, I would thank them. Thank you so much for your time. If you have any questions, just let me know. And then I would wash my hands one more time. And then after the full exam and they didn't have any questions, I would just walk out the door.